think shockwaves are just for earthquakes. They are powerful enough to break up your foot pain. Hello, my name is Tiffany. I'm the podiatrist, works at the Feet First Podiatry in Singapore. I've been doing this for about 20 years, focusing on inguinal surgery, shockwave therapy, and nail restoration. Shockwave therapy is known as extracorporeal shockwave, ESWT. It is a non-invasive treatment that is often used in an outpatient setting by clinicians, podiatrists, and doctors. We often use the treatment to treat some of the chronic inflammation, foot problems, for example, like plantar fasciitis, Achilles tendonitis, and neuropathy. How the treatment works is it actually uses short sound wave to destroy the damaged tissue and promote the healing. It also provides the collagen synthesis as well as to provide pain relief instantly after the treatment. Shockwave therapy, again, is a really safe and non-invasive treatment, so it often gives a really promising results. Most of our patients, after 10 minutes in session, they would feel an immediate relief. So I would say probably 80% of the clients that we have seen do receive a really positive feedback in terms of their foot positions. Majority of the patient will need to be repeated. That means revisit their podiatrist for the shockwave therapy once a week. Most of the patients that we see in our clinic with a chronic foot condition, average-wise, they will receive up to 3, maybe 4 sessions to achieve pain-free results. So I would say shockwave therapy is a really safe, non-invasive, affordable, and effective treatment for people suffering from foot conditions. So upon receiving your first shockwave therapy, your doctor or podiatrist will obviously assess where is the location and what's the pain level of your condition. So for example, treating a plantar fasciitis, which is commonly known as heel pain, we will locate at the bottom of your foot. A gel application will be then applied. It is to help with the sound wave to transmit from a handpiece into the foot tissue. Later on, your doctor will then get a shockwave handpiece and place directly onto the gel onto your foot to administer. Remember, this setting can be adjusted between you and your doctor. So obviously, from a clinician point of view, the more we could provide to you, the better it is. On the first treatment, you will receive some discomfort. Most likely, it's more like an end-spite sensation, some burning sensation. Usually, the treatment can last for between 10 to 15 minutes. Most of our patients will feel immediate relief right after the treatment. So some of the aftercare advice for patients receive the first shockwave therapy is to plenty of rest at home, wear proper shoes, and most importantly, to drink lots and lots of ice water. Remember, the shockwave therapy is to activate your system to self-heal the injury. So obviously, it will create some heat into your system. So it is advisable to drink plenty of ice water, not warm water. It's gonna help with the healing process. Shockwave therapy is great for people who suffers an acute and chronic foot conditions. Some of the common conditions that we see in our clinic gets a really positive results were those with plantar fasciitis, known as heel pain, Achilles tendonitis, known as inflammation of the Achilles tendon at the back of your legs, sesamoiditis, and neuropathy. So those conditions are mostly chronic inflammatory foot conditions. For those who's currently suffering from those foot conditions like plantar fasciitis, Achilles tendonitis, or any kinds of chronic inflammatory foot conditions, do look for your doctor or podiatrist and ask more about shockwave therapy today.